Eye twitching is a surprisingly common experience that many people encounter at some point in their lives. Often described as a brief, involuntary spasm of the eyelid muscles, these twitches can occur without warning and usually resolve on their own. Despite how frequent they are, eye twitches often go unnoticed or are dismissed as insignificant. This is partly because they are usually harmless and short-lived, causing little discomfort. However, their subtlety can also lead to misunderstanding or unnecessary concern when they persist. Understanding why eye twitching happens and recognizing its benign nature can help alleviate worries and promote better awareness of this everyday phenomenon. The eyelid is a thin fold of skin that protects and lubricates the eye. It consists of several layers, including skin, muscle, connective tissue, and the inner conjunctiva. Two primary muscles control eyelid movement: the orbicularis oculi, which closes the eyelid, and the levator palpebrae superioris, which raises it. Involuntary twitching, known as myokymia, typically involves small, repetitive contractions of the orbicularis oculi muscle. These twitches are usually harmless and often resolve on their own. Understanding the anatomy and muscle function of the eyelid helps explain why these brief spasms occur. Eye twitching, also known as myokymia, begins with electrical signals generated in the brain. These signals travel along the facial nerve, which is responsible for controlling the muscles around the eyes. When the brain sends a rapid or repeated message, it can cause the eyelid muscles to contract involuntarily. Factors such as stress, fatigue, or caffeine can heighten the sensitivity of these neurological pathways, making twitches more likely. The precise coordination between the brain and facial muscles is usually seamless, but minor disruptions can lead to noticeable spasms. Understanding these signals helps explain why eye twitching is typically harmless, though it can sometimes be persistent or bothersome. Eye twitching is a common experience that many people encounter at some point in their lives. One of the primary causes is stress, which can trigger involuntary muscle movements around the eyes. Fatigue is another frequent contributor, as lack of sleep can make the eyelid muscles more prone to spasms. Consuming too much caffeine may also lead to twitching, since stimulants can affect the nerves and muscles. Additionally, prolonged periods of eye strain, such as staring at screens for extended times, can overwork the eye muscles and result in twitching. While these causes are usually harmless, understanding them can help in managing and reducing the frequency of eye twitches. Eye twitching is often dismissed as a minor annoyance, but it may carry subtle messages from the brain. These involuntary muscle movements can sometimes signal underlying emotional or physical states. Stress, fatigue, or even excessive caffeine intake are common triggers, suggesting that the body is responding to internal pressures. In some cases, eye twitching might be the brain's way of alerting us to the need for rest or relaxation. While usually harmless, persistent twitching could indicate that it's time to pay closer attention to our overall well-being. Understanding these signals can help us address the root causes and maintain better health. Persistent or severe eye twitching can sometimes be linked to underlying medical conditions. These may include neurological disorders such as blepharospasm or hemifacial spasm, which require specialized evaluation. Other causes might involve issues like dry eyes, inflammation, or even side effects from certain medications. If the twitching lasts for several weeks, affects other areas of your face, or is accompanied by additional symptoms such as vision changes or weakness, it is important to seek professional advice. Early consultation with an eye care specialist or neurologist can help identify the cause and guide appropriate treatment. Recognizing when eye twitching is more than a minor annoyance can be crucial for your overall eye health. Managing and reducing eye twitching often begins with simple lifestyle adjustments and attentive self-care. Prioritizing adequate sleep can help your eyes recover from daily strain, while regular breaks from screens may reduce fatigue. Staying hydrated and maintaining a balanced diet rich in essential nutrients, such as magnesium and potassium, can also support healthy muscle function. Limiting caffeine and managing stress through relaxation techniques like deep breathing or meditation may further decrease the frequency of twitches. If you wear contact lenses, ensure they are clean and used as directed to prevent irritation. By incorporating these practical habits into your routine, you can often minimize discomfort and promote overall eye health. In summary, being mindful of your body's subtle signals can make a significant difference in your overall well-being. Often, early warning signs are easy to overlook, but they can provide valuable insights into your health. By paying closer attention to changes, no matter how minor they seem, you empower yourself to address potential issues before they become serious. Remember, your body communicates in many ways, and listening closely can help you maintain a healthier, more balanced life.